A very good day. My name is Ain. So today I would like to present an IPD case, which is a nutrition management of decompensated liver cirrhosis secondary to CLD. For nutrition assessment, patient is Mr. Y, 74 years old male, patient diagnosed with decompensated liver cirrhosis secondary to CLD. Patient have underlying of hypertension, dyslipidemia, ischemic heart disease, and chronic hepatitis C. During admission, patient complained of abdominal bloated, which is worsening for the past 2 months. Patient have a shortness of breath, which is worsening for the past 1 month, and patient have loss of appetite for the past 2 months. Patient does not have any fever and chest pain, but patient have no bowel output for the past 5 days. For social history, currently patient stay with wife and weekly visited by his children, which is 2 daughters and 1 son. And patient is an ex-smoker, which patient had quit 20 years ago, and patient is a non-alcoholic drinker. So for anthropometric measurement, patient height is around 166 cm. Patient usual body weight is around 65 kg. However, patient current weight is 58 kg, which is after removal of peritoneal fluid. And patient BMI is around 21 kg per meter square, which is considered underweight for elderly patient. And for ideal body weight by using BMI 24 kg per meter square, patient ideal body weight is around 66 kg. And based on patient current weight and usual weight shows that patient have 10% weight loss from usual weight. For biochemical data shows that for random profile, patient have is lower than normal range, and it might be due to patient have ascites. For liver function test shows that patient albumin and total protein level are lower than normal range, and total bilirubin, ALT, and ALP are higher than normal range. All of this might be due to patient have ascites and patient have underlying of hepatitis C. For full blood count shows that the hemoglobin level is lower than normal range and the white cell count is higher than normal range. And this might be due to low production of red blood cell as patient currently have liver disease and patient have inflammation. This is the medication, and based on the medication shows that patient is currently on furosemide, which is a diuretics. Also, patient on lactulose as patient currently have no bowel output for the past 5 days. Patients also have on ribavirin, which is antiviral medication to treat hepatitis C. Patient also on propranolol, which is to treat the hypertension and the angina if a patient have chest pain, and also heart rhythm disorder. And patient on simvastatin, which is to help to lower down the blood level of LDL, to increase the level of HDL, and to lower the triglyceride. And lastly, patient also on Lasix, which is also a loop diuretics medication. For nutrition focused physical findings shows that patient is have abdominal distended, which is ascites, and patient have mild jaundice, multiple bruises at the upper and lower lip, and does not have any oral complication. And based on the IO shows that patient have negative 3,500 for balance. And this might be due to patient have 3 liter removal of peritoneal fluid, and patient have 1 bowel output. And for the abdominal growth shows that patient is around 101 cm, and this might be due to patient have ascites. For food and nutrition history, patient estimated intake is around 995 kcal per day, which is only meet 50% from the requirement, and it is estimated around 44% of carbohydrate, 13% of protein, and 90% of fat. Based on the record also, the estimated sodium intake is around 1,800 mg per day, with the estimated fluid intake is around 1,700 ml per day. And based on the estimated intake shows that patient does not meet the requirement, which might be due to patient have poor appetite as patient have abdominal distend. And patient also seems to have a high amount intake of fluid, which can can increase the severity of the ascites symptom. And Patient reported tend to eat outside during weekend. Patient like to take high sodium foods such as soy sauce, rock salt, pickles, canned foods such as sardine, baked bean, and fast food. And as for food intake, patient reported he tend to take 1 glass of warm water every morning, once patient awake, and one exchange of fruits per day, and drink around 3 to 4 glasses of water throughout the day. And patients also seems to like to eat high fat foods such as fried fish, and take a lot of gravy, especially based on the diet called is curry gravy. Okay, for the dietary requirement by using dosing weight of 66 kilogram, the energy requirement, which is using quick method with the energy factors of 30 kilocal per kg, shows that patient energy requirement is around 2000 kilocal per day. However, by using mifenysanju with activity factor of 1.1 and stress factor 1.2, shows that patient energy requirement is around 2100 kilocal per day, which does not have only 100 kilocalorie difference. And for protein requirement shows that patient I choose 1.2 gram per kg body weight, which is based on Aspen 2006, is suitable for patient with liver cirrhosis, and the protein requirement is around 79 gram of protein per day. For nutrition diagnosis, I have two nutrition diagnoses, which is first, inadequate oral intake related to poor appetite due to symptoms such as ascites, as patient tend to have already satiety, as evidenced by patient estimated energy intake is around 995 kcal per day, which only meet 50% from the requirement, and which does not meet the daily requirement, around 2000 kcal per day. And the second ND is excessive fluid intake related to physiological causes, as patient have ascites due to liver disease, as evidenced by patient estimated fluid intake is more than requirement, and patient have abdominal distension. For nutrition intervention, for the objective, first I will to optimize the energy and protein intake to attain and maintain normal weight range. And second is to control sodium and fluid intake to prevent from water retention. For the intervention plan, based on under domain of nutrition education and counseling, first I will educate patient on type of high sodium food by using food checklists. Second, I will educate patient on how to monitor fluid intake to prevent from water retention by first teach patient to measure fluid using household measurement, and and then next I will suggest patient to use a bottle that have fixed volume, for example like 500 ml of mineral water. And third is to avoid eat high water content fruit and vegetables such as watermelon, peach, pear, cucumber, but instead choose low water content fruit such as guava and banana. Next, I will educate patient on to eat healthy balanced meal by using healthy plate model, suku-suku separuh, and I will also educate patient on type of fat and high fat food by using food checklist, which is as patient have dyslipidemia. And for food and nutrition delivery, will indent patient low salt diet with RF 800, and also prescribe oral nutrition supplement, which is Nova Source 1 packet per day during breakfast, which provide around 475 kilcal kilcal with 21.6 gram of protein. I choose Nova Source because it is suitable for patient that need to have water restriction. For nutrition and monitoring and evaluation, first I will monitor on the anthropometry, which is to monitor the weekly weight changes. Second, I will monitor the biochemical data, which is LFT, RP, and FPC. And third, I will monitor on dietary intake, which is the dietary compliance and the compliance on ONS, and also the fluid intake. As for discussion, patient with liver cirrhosis will have normal or increased protein turnover due to increased protein breakdown or reduced protein synthesis. So it is really important to ensure patient that have liver cirrhosis have adequate amount of protein intake. So the energy intake for the energy requirement for patient with liver cirrhosis is around 30 to 35 kcal per kg body weight, and the protein requirement is around 1.2 to 1.5 gram per kg body weight. This is based on ASPEN 2006. So additionally, patient with decompensated cirrhosis and ascites will experience satiety because of the intrinsic compression of the gastrointestinal tract from peritoneal fluid. So management for ascites is really important to ensure patient can take adequate amount of protein and energy intake. And the management for the management for ascites is by uh, giving sodium restriction, which is providing low salt diet, and also restriction of fluid, which is decided by the doctor. That's all for me. Thank you.